Hey guys, so just want to give you a little brief overview of chapter 1 and what you've read and what you've heard from the PowerPoint and me talking to you. So you have a quiz due on Sunday. It has 5 questions. You're timed. You have 2 attempts. So it will shut you out after those timers go off. I do believe it's 15 minutes that it's set to. You can use your notes, you can use your book, but you cannot use the internet. So some things I want to address. Your wellness paradigm, it includes physical, mental, social, emotional, environmental, and spiritual. Those are your 6 elements of your wellness paradigm that all make up health and wellness. If one category is off, usually you feel off. If you're not spiritually well and you're a spiritual individual, you probably don't feel good. If you don't feel physically well, you're probably not well. So if there's one piece of that category or one piece of that puzzle that's just not fitting for you, you probably don't feel 100%. So there's a lot of pieces that go into that we have to nurture each piece of the wellness paradigm, which is typically why we're so exhausted. Excuse me, because we're burning the candle and we're trying to maintain all of these moving pieces, and we're trying to keep up with our spirituality, our emotional wellness, our social wellness, all of these things, and so it takes up a considerable amount of time. I do want to reiterate that in your PowerPoint it says financial and occupational wellness are not a part of that wellness paradigm, and I'm reiterating that point again to you, that financial and occupational wellness are not part of the wellness paradigm. The next thing I want to hit on is that women do live longer, 5 to 10 years longer, and that is not because women are better or because we have some sort of magical gene that just makes us live longer. It's typically because and this is going to sound silly, but it's typically because women do not make as rational or irrational, risky decisions. So we tend to live longer as a result of those irrational decisions. Also, heart disease affects more men more often than not. And nutrition, physical activity, women are more likely to play in factor of nutrition versus men, so all of that plays into the 5 to 10 years longer in lifespan. Your chapter also talks about 2 different types of diseases. You have communicable and non-communicable. Non-communicable means that you cannot get that disease from anybody else. So say you're standing next to somebody and they have that disease, you cannot get that from touching them, being around them, even kissing them. So things like heart disease, cancer, you can't get those things from somebody by just being around them. You just can't. So those things are not anything that you can pass along. So think about non-communicable and communicable diseases that you can communicate, or you can pass along that disease, like you're communicating something and you're passing information off. So non-communicable means that it is non-sharing. Communicable means that it is sharing. So an example of communicable disease would be HIV, or mono, sinus infection, strep throat. All of those things we can catch from someone else just being in the vicinity of them or even kissing them. That's a higher grade or a greater risk if you do that. So it is something that you can get from someone else being near them, touching them, kissing them. You can get all of those things that I just talked about. And then the other thing I want to talk to you about is the definition of health and the difference between health and wellness. So there is a pretty big difference, and that's talked about in your PowerPoint. But health is defined as a condition that is on a continuum from positive to negative or negative to positive. So we're all in this continuum in health. It's a journey, not a destination, essentially. And so health is on that continuum, whether you're in a positive or negative. But remember, there is a definition between health and wellness, and you should check your chapter out. I really hope that these videos are helpful and informative to you and that you take value in them. If not, please let me know. Have a great week, guys.